erythrocyte sedimentation rate, otherwise called as your ESR test. Objectives of this test. From this test we're going to learn the principle of ESR, why do we perform ESR, mechanism involved in ESR, types of tests to determine ESR, and a clinical condition where increase or decrease ESR is reported. Okay, for carrying out ESR, please remember that we always use anticoagulated blood, and anticoagulant we mostly use is your EDTS and your sodium citrate. Okay, now coming to the principle, when an anticoagulated blood is placed in a vertical tube and is allowed to stand, RBC is sheltered towards the bottom of the tube. The speed of sedimentation of RBC in plasma over a period of 1 hour is measured by the length of the sedimented RBC column and is expressed in millimeters. Now why do we perform ESR test? ESR is a commonly non-specific test in routine clinical practice that doesn't diagnose one specific condition. Instead, it helps the healthcare provider in determining whether we are experiencing inflammation. It also reflects the tendency of the red blood cells to settle more rapidly in the face of some disease state, usually because of increased plasma fibrinogen, immunoglobulins, and other acute phase reaction protein. Changes in the RBC shape or number may also affect the ESR. General procedure involved in ESR test. When the anticoagulated whole blood is allowed to stand in a narrow vertical tube for a period of time, the RBCs under the influence of gravity settles out from the plasma. The rate at which they settle is measured as a number of millimeters of clear plasma present at the top of the column after 1 hour. That is expressed in millimeters per hour. There are basically two types of method that we use to determine ESR. One is the Western method and the Wrinkles method. We will be discussing about the Western and Wrinkles method in detail and the differences between these two tests. Now we're going to look at the mechanism of how ESR takes place. There are basically three stages. The first stage is a rouleau formation that takes place in the first 10 minutes. As you can see in this diagram, rouleau formation means stacking of RBC on top of each other. Okay. Then the second stage is the stage of sedimentation or settling. It takes about 40 minutes. And the third stage is the stage of packing. It takes about 10 minutes. This third stage takes place when sedimentation slows down and your cell starts to pack at the bottom of the tube. ESR is determined by interaction between factors that promote sedimentation and factors that resist sedimentation. Factors that promote sedimentation are your fibrinogen, immunoglobulins, and acute phase protein, which are generally increased during inflammation, trauma, infections, etc. Okay. And the factor that resists sedimentation are the negative charge of your RBC. Okay, so normally this RBC they repel each other and doesn't allow sedimentation. Okay, normal RBC settles slowly as they do not form rouleau, okay, due to the negative charge. Instead, they gently repel each other due to the negative charge, as I've already told you. So when rouleau formation occurs, RBC becomes heavier and sediment faster. Now how does that happen? Okay. When there's an increase in your plasma protein, especially fibrinogen, these fibrinogen adhere to the red cell membrane and neutralize the surface negative charges. Okay, when these negative charges are neutralized, they stop repelling. Okay, and when they stop repelling, they promote cell adherence and rouleau formation. Alright, it's also important to know that ESR is directly proportional to the weight of the cell aggregated and inversely proportional to the surface area. I've already mentioned you in my objective. There are two types of tests. that we can determine ESR. One is the Western grain method and the Winthrop method. Right now we are going to discuss about the Western grain method. Alright, what are the materials needed? We need a long needle syringe, okay, to load the blood, that is the anticoagulated blood. And we can see here Western grain tube, okay, it is straight glass tube of about 300 millimeters or 30 centimeters in length. The internal diameter is about 2.5 millimeter and has a capacity of 1 ml, and the scale graduated from 0 to 200 millimeters or 0 to 20 centimeters. Okay, when we load the blood, we place our Western grain tube in this Western grain rack, alright, and then we allow it to settle for 1 hour. Western grain procedure. The Western grain method requires collecting 2 ml of venous blood in a tube containing 0.5 ml of 3.8% sodium citrate. Remember, I've told you sodium citrate is an anticoagulant, right, that prevents clotting of blood. Okay, after collecting the blood, it should be stored no longer than 2 hours at room temperature or 6 hours at 4 degrees Celsius. The blood is drawn into the Western grain tube to the 200 millimeters mark, right? Then the tube is placed in a vertical portion for 1 hour at room temperature without any disturbance. The distance of fall of erythrocyte is expressed as millimeters in 1 hour. Using Western grain method, normal value for male is 0 to 10 millimeters after 1 hour, female is 0 to 20 millimeters after 1 hour, and children is 0 to 10 after 1 hour. The other method for determining your ESR is called your Winthrop's method. Okay, I've already discussed your Western grain method. Now we're going to check the Winthrop's method. As we can see in this diagram, the Winthrop tube is a narrow glass tube measuring around 110 millimeter or 11 centimeters long, with the graduation markings from 0 to 10 in both ascending and descending. Okay, the internal diameter of the tube is around 2.5 millimeter, and after loading the blood, this tube is again placed in your Winthrop stand. The procedure for carrying out the Winthrop's method. The Winthrop method is performed similarly to that of the Western grain method, the difference being the size of the tube. The Winthrop tube is much smaller compared to the Western grain tube. The Western grain tube is around 3 times longer than your Winthrop's tube. Okay, now the anticoagulant used here is your EDTA. We use EDTA out here compared to your Western grain, which we use your sodium citrate. So what is the advantage of using Western grain over Winthrop's? The advantage being the shorter columns makes this method less sensitive than the Western method because the maximum possible abnormal value is lower. However, this method is more practical for demonstrating process. Normal ESR value by Winthrop's method. In male it's around 0 to 9 millimeters fall at 1 hour. In female is around 0 to 20 millimeter fall at 1 hour. Now let us look at the factor that increases ESR. Factor that increases ESR includes anemia, inflammation, infections like HIV, tuberculosis, acute viral hepatitis, rheumatoid arthritis, bacterial endocarditis, pregnancy, kidney disease, cancer, lymphoma, and multiple myeloma. And condition that decreases ESR are polycythemia, that is increased RBC count, hyperviscosity, sickle cell anemia, leukemia, low plasma protein, congestive heart failure, newborn infants, and dehydration. Thank you.